A 45-year-old male presents with an itchy, erythematous rash on his elbows and knees and shoulders. On examination, you notice well-defined, scaly plaques with silvery scales. What is the most likely diagnosis? A. Atopic dermatitis. B. Psoriasis. C. Contact dermatitis. D. Eczema. Answer: B. Psoriasis. Explanation: psoriasis typically presents with well-demarcated, erythematous plaques covered by silvery scales, commonly affecting the elbows, knees, scalp, and lower back. It is a chronic autoimmune condition characterized by abnormal proliferation of keratinocytes. The presence of silvery scales and involvement of extensor surfaces are characteristic features of psoriasis. A 25-year-old female presents with a sudden onset of multiple painful, fluid-filled vesicles on her lips. She reports a tingling sensation prior to the eruption. What is the most likely diagnosis? A. Impetigo. B. Herpes simplex virus, HSV, infection. C. Hand, foot, and mouth disease. D. Angular cheilitis. Answer: B. Herpes simplex virus, HSV, infection. Explanation: herpes labialis, caused by horsefly, typically presents with painful, fluid-filled vesicles on the lips. Patients often report a prodromal tingling or burning sensation before the appearance of vesicles. It is a common viral infection that can recur periodically. A 60-year-old male presents with a slowly enlarging, pigmented lesion on his face. On examination, you note asymmetry, irregular borders, variegated color, and a diameter of 1.5 centimeters. What is the most concerning feature for melanoma in this scenario? A. Slowly enlarging lesion. B. Pigmented lesions. C. Irregular borders. D. Diameter of 1.5 centimeters. Answer: C. Irregular borders. Explanation: the presence of irregular borders is a concerning feature for melanoma. Other concerning features include asymmetry, variegated color, diameter greater than 6 mm, and evolution or change in size, shape, or color over time. Melanoma is a malignant skin neoplasm arising from melanocyte and carries a risk of metastasis if not detected and treated early. A 30-year-old female presents with pruritic, erythematous papules and vesicles on her hands. She works as a hairstylist and frequently comes into contact with hair dyes and chemicals. What is the most likely diagnosis? A. Atopic dermatitis. B. Allergic contact dermatitis. C. Irritant contact dermatitis. D. Scabies. Answer: B. Allergic contact dermatitis. Explanation: allergic contact dermatitis is a delayed hypersensitivity reaction to an allergen, resulting in pruritic, erythematous papules and vesicles at the site of contact. In this scenario, the patient's occupation and exposure to hair dyes and chemicals suggest allergic contact dermatitis as the likely diagnosis. A 55-year-old male presents with a solitary, firm, flesh-colored nodule on his face. He reports that the lesion has been slowly growing over the past few months. What is the most likely diagnosis? A. Basal cell carcinoma. B. Squamous cell carcinoma. C. Dermatofibroma. D. Seborrheic keratosis. Answer: A. Basal cell carcinoma. Explanation: basal cell carcinoma is the most common type of skin cancer, typically presenting as a solitary, flesh-colored or pearly nodule with telangiectasia. It commonly occurs on sun-exposed areas of the skin and tends to grow slowly over time. Although it rarely metastasizes, early detection and treatment are essential to prevent local tissue destruction.